This segment sponsored by Viking Psychiatry. Welcome back to Mental Health Matters with Viking Psychiatry, and today we're going to be discussing the rising concern of medication overuse in mental health, and here to share all about it is Sean Goddard, owner of Viking Psychiatry. Hi, Sean.
Hi.
Welcome back.
Thank you.
Okay, I always love chatting with you because you bring some really interesting information to the table, and it's so informative. And so today we're going to talk about medication use, and when people think about it, number one, how is medication used in mental health, and why is there an overuse happening?
Yeah, I think it's really a combination of things, right? Medication is being prescribed to help with sleep because so many people struggle with sleeping correctly, right? Going to sleep, staying asleep, shutting their brains off, depression, anxiety, right? There's so many different things going on in mental health and so many different medications that are available out there, which can be very beneficial in the right situation, right? But I think you have a combination of, sometimes I tell people we're kind of a little bit of a Burger King society. We want things our ways right away, right? And regretfully, mental health is not something that often can be just fixed overnight. It takes work and time, right? But we don't have that time a lot of times to commit, or feel like we don't have the time. And so the hope is that a medication, a pill, will be able to fix it and resolve it all. On top of that, we also deal with a medical environment that is really just revenue-based, right? It's about the numbers, and reimbursement from insurance companies are getting worse and worse. And it's not about being able to spend time and sit and spend time with a client. Instead, it's about making sure that you stay in the green. And to be able to do that, you have to see more and more and more clients. And so that provides less and less and less time to actually sit and have a conversation with somebody. And so what that often leads to is minutes of conversation and then an immediate prescription, right? And often very little time talking about that prescription. There should be informed consent where you're being educated about the medication, the potential side effects, the risks, the benefits. But far too often that prescription is just being handed out and say, take this. And so I think it's a combination of all of those things combined that have led to a significant rise of not only medication use, but instead of individuals being on one medication, now they're on two, now they're on three, now they're on five, right? So we see what we call polypharmacy, and the interactions that can occur by being on so many different medications.
Yeah, and you talk about it being revenue driven in a way. I mean, these pharmaceutical companies are really making a lot of money. They're really pushing their product. And people can gain a level of dependency on those products, unfortunately. And so how can someone recognize if they are dependent on a drug or if they are overusing medications that's meant to help them?
Yeah, one of the things that we look for is when people decide to change dosing on their own, right? So if I've prescribed you a medication and I ask you to take this certain milligram and take it once a day, and you decide, well, on your own with no conversation with your provider, that, it helps, but I think it's going to help me more if I take it twice a day or 3 times a day, and you start doing that without speaking to your medical provider to do that sometimes can be a sign of dependence or misunderstanding. There's a lot that can go along with that. As well, if the medication has helped and you've had a significant improvement, and then your provider says, okay, I want to begin reducing this medication, and you immediately, your response is, no, why? We can't do that, right? And even though that, when a client comes to me, sometimes when clients come to me, they say, well, if you're going to prescribe me this medication, do I have to be on it forever? That's the fear, right? And so instead we have a conversation about what treatment looks like, and when we get to a certain point of stability, we're going to start reducing it to see if we can get you off of it. And most people want to begin that reduction, right, and see if they can do well without the medication. But when there's a sudden knee-jerk response of, oh no, I can't do that, I need this, I have to have this to be able to do well, well, there can definitely, it might not be so much of a physical dependence, but instead a psychological dependence on that medication. Those are some of the signs that we look for.
Yeah, that's so interesting. And I think about what you said at the beginning about having options through time. You know, the more time that you have, you can explore more options. And I think that people do not take the time because sometimes medicine or treatment in that way just seems like an easier thing. You know, you and I have discussed a lot. I'll just, share about myself. You know, I have sleeping problems. You know, I have insomnia. And so I will take a sleeping pill. But I think that you have methods to really go deeper into the brain therapy and to really understand what is the underlying issue and then treat holistically through that. And so let's talk about those alternatives and how if someone is suffering from stress, depression, or anxiety, there are alternatives through your treatments.
Yeah, so, sometimes people feel like when we talk about these alternatives, we're beating a dead horse, right? Like I can talk to you about therapy and the benefits of therapy, and I can talk to you about, if you're not having a sleep issue, the help of getting ensuring you're getting the proper amount of sleep, right? I can talk to you about vitamins and tracking hormone levels and checking the thyroid and doing all of these types of things. Those all can be extremely beneficial, but sometimes it can be very hard to follow those steps. The other side of it is sometimes we're just treating the wrong thing, right? Like using your example where you discuss having difficulty with going to sleep and you're taking a sleeping medication. I can't tell you how many times that I've had somebody who has been diagnosed with a sleeping insomnia, prescribed a medication to help them go to sleep, but the problem isn't necessarily the sleep issue, it's the underlying anxiety or the underlying ADHD that is not allowing our brain to shut off so that they can go to sleep.
Right.
And instead of properly going to the root and finding what the issue is, the answer was, oh, you're complaining of sleep problems? Well, here's a sleeping pill to help you go to sleep. When sometimes the time needs to be spent to see what that underlying issue is and addressing that opposed to just what we call slapping a Band-Aid on it by prescribing a pill for sleep.
Yeah. It's so funny because, it is like that constant brain work at night, and it's like not being able to, shut it off. And I will like lay down, and maybe it's anxiety to sleep. It's so weird. It's like I hate to go to sleep and I hate to wake up. It's like once I'm asleep, I'm like, oh, let me stay asleep. So that's good, though. That's good. Understanding the underlying issues. And then back to the discussion, though, of the medication overuse. How can someone really approach this conversation with their medical provider just to make sure that they are not overusing or doing some of the things that you mentioned, which is absolutely horrible if someone's doubling their medicine or trying to self-diagnose?
Yeah, we really have to advocate for ourselves even more and more. As a nurse, when I went through school initially as a nurse, one of the things we're taught is advocating for our patients, right? Being the voice for our patients. But regretfully, in the system that we're at now, there isn't a lot of advocating going on because there isn't time for advocating. That nurse that you see, you're with them just for a minute or two before you're in and you're seeing the provider, right? And so we really have to advocate for ourselves nowadays. And so if you're walking into an appointment and you have these concerns and you also know that this is an appointment that's typically rushed, you can do a couple things. One, you can call ahead for your appointment and have it marked down on the appointment that this is an issue you wish to discuss.
Yeah.
And then I also recommend bringing your questions in, having them pre-written down, because how many times do we walk into a room with all these intentions, but once we're put in that spot and other questions are being asked, and then all of a sudden we forget what we were going to talk about or the concerns we had, right? And so, and being able to say, this is my concern is so important, and advocating for yourself for that.
Yeah.
So you can do little things to set yourself up for that. And maybe you also need to make sure that they book more time for you, right? And so by calling ahead and doing that question and saying, is my appointment going to give me time to be able to talk to my provider about this concern, or do I need to reschedule my appointment to where you guys can give me more time allotted to my provider so that we can have that conversation because it's important to me. So.
Yeah, and it's really all right, because if we're making an appointment and we're paying for the appointment and we're paying for a deductible deductible, it's like we should get the services that we
Absolutely.
need. And just one thing I would add is not to be intimidated by the doctor. Like, by being a self-advocate, that doesn't mean that you just have to be quiet and sit there. It's okay to say, wait, could you slow down? Could you explain this to me? I have these concerns. Would you mind addressing it? Because I've experienced doctors that will just like speed talk and just want to check. And I'm like, hold up.
Right.
And it's okay to say that because, they are the professional and you need their medical attention from them.
Sometimes we're seeing people and we're seeing those individuals just because we felt like that was our only option, or that's who my mom saw, right?
Yeah.
Or my sister referred me here, right? Just because somebody else has a good experience doesn't mean that you're going to have a good experience. And things have changed over time. So if you have a provider that you're seeing and you're feeling that you're not being heard, or they're not willing to take the time to hear you, then maybe it's time to find somebody who will, because that's important. That's what we're there for when we're caring for individuals. And sometimes providers need to be reminded of that, I understand that you're busy. I understand you have all these clients to see, but right now I'm the client and I'm in front of you and I have these issues and I need them addressed. And if they're not willing to address them or educate you and teach you and walk you through your concerns, then maybe it's time to find somebody who will.
Absolutely. I love that. I love that as a provider, that's front of mind and you practice what you preach. So thank you so much,
Thank
Sean.
you.
And if you would like more information about Viking Psychiatry, we'll have their website listed below, and I'll see you after the break.
This segment sponsored by Viking Psychiatry.